Wangda is currently working as the executive director of Laksam. Laksam is a registered NGO formed by a network of people living with HIV/AIDS in Bhutan. Wangda was leading a normal life until his life took a U-turn as he found out that he was HIV positive. The news was shocking, but most shocking was the discovery that because of him, his wife, whom he trusted and loved, was also detected with HIV positive today. Well, do listen to Wangda's story and his fight to battle stigma and discrimination in the society. How did you come to know that you actually were suffering from HIV positive?
Yes. Firstly, thank you to BBS and also to our listeners. I was detected as HIV positive in 2006 when my wife was carrying a second baby. So through the antenatal care, we have been offered voluntary counseling and testing, to which we accepted, and we got detected as an HIV positive in 2006. But fortunately, since we got detected on time, and I'm still strong, and my 4 children are HIV negative because we got detected on time.
Yes. And then the moment that you came to realize that you were suffering from this HIV positive, how was your instant reaction?
Yes. So when I was, told that I have HIV virus in my body, it was in a small room, empty room. There was only 2 chairs and 1 table and another 2 chairs, from the opposite side. And to where the 2 counselors said, and my wife and me, we sit, in the opposite direction. And my wife and me, we were told that the HIV virus is very active in our body.
Yes.
When they told me this, I was lost for some time and couldn't come to myself for some time.
Yes.
But when suddenly I came to myself, then the only word that I spoke to my counselor was, who got the infection first?
Yes.
So the counselor told me that by looking at the body immunity, they had checked. It seems that I got the infection before my wife. They told me that I have been living with the infection for last 7-8 years. It was only because I didn't check for HIV. So when I was told, then I started feeling really guilty. I couldn't look directly at my wife's face, although I didn't, give this disease to my wife intentionally. But then I felt guilty. And when the counselor told that HIV can be transmitted from infected mother to a baby, then I started getting more worried because my wife was carrying a baby in her womb. So I was
taken back.
Yeah, I was really taken back. But fortunately, they told us that there is an prophylaxis, a medicine, antiretroviral medicine to prevent, the transmission of HIV from mother to child, and it can reduce the risks to a very, very maximum level. So that's how my 4 children are HIV negative today.
Yes. And then in a similar way, how was your wife's reaction to it when she knew that she got HIV from you?
Yes. So that day, it was towards the evening side. We were heading towards our house. So in the night, the children are asleep, and we have been talking to ourselves, and I said, I'm sorry, I didn't know that I was HIV positive.
Nice.
And my wife, what she said was, it's all right, if I had a faith, if I was, bound to get this HIV virus.
Nice.
Not necessarily, I had to get from you. Even if I don't stay with you, and if I'm with others also, there is chances that I will get the virus. She actually, blames her faith.
Yes.
So she is very supportive. She is very caring. So that's how we live very positively and happily with our family.
Well, that's very encouraging story indeed. And yes, after all these things that you have gone through, I believe a group of you made a move to come out to public, and
Yes.
I guess you all did it. So after that, how has the course of your life been? Did it make a difference?
Yes, I think before we came out in the media, as we all Bhutanese people know that in the general population there was a rumors that the people living with HIV and AIDS should be having a mark on their thigh. Yes. So that they can be recognized by other people. Often, and on an annual basis, when the Ministry of Health announced in the media that this much people are detected with HIV, and they are taken good care of. Often people misunderstood, they thought that people living with HIV and AIDS are segregated from the general population, and they are fenced and kept there and treated there and paid there and made them die there.
Yes.
That was the feeling of the general population. Yes. And often people felt that people living with HIV and AIDS should be one, lying in the corner, helpless, sick, mentally deteriorated. That sort of a feeling, people actually had. Because actually that message I had also because of the past global HIV AIDS advocacy posters showing skeletons, deadly disease, or HIV AIDS is a killer or something like that. That's why people have that perception. But after we came out in the media, actually we feel that. And thank you to BBS also, in jointly in collaboration with the BBS, Ministry of Health, and other relevant organizations and donors. We feel that we have given HIV a human face in Bhutan for the first time. Now Bhutanese people know that how actually the people living with HIV look like. So I feel that most of the misconception has been removed, because after all, ultimately when they see people living with HIV live, they saw them as a father, they saw them as a mother, they saw them as a brother, sisters. No different from other people. So we feel that we have given HIV a human face in Bhutan for the first time. And after we came out, many people came to us, shook our hand, hugged us. Some people wanted to snap with us. Some people want to see that they have got tested because people came out in the media. It encouraged us or it empowered us. Even our HIV positive people, those who have been not initiating their treatment on time, are now seeking their treatment on time and services on time and are living a better life within their community, within their family, and they are being very productive now.
Yes.
And also when we say that we get such support, social support from the community, from the society, but at the same time we also face many stigma and discrimination.
True.
But for me it doesn't matter, because I should say that I'm an empowered guy. I take everything positively, but for my other friends it is quite tough. So I request all the Bhutanese people that please show solidarity, please show your social support. It makes us better, it makes us stronger to fight HIV and AIDS. I think it's a joint concern, it's a shared responsibility that every human soul in Bhutan should come together to fight HIV and AIDS. Because one should think, when one goes to sleep, I think it's very important that one should think, am I at risk of getting HIV? Are my family at risk of HIV? Are my children's generation time going to be free from HIV? And if one asks that question to oneself, I think no one would say that we are not at risk. Everyone would say that we are at risk. We should come together. We should fight this HIV AIDS together. And that's what we want, social support. Without the community and social support, people support, HIV program will not work. I'm speaking frankly.
That's true.
Please support.
Yes, I hope our listeners have heard what Mr. Wangda is really trying to put forth, and I guess a move that was taken earlier was quite worthwhile, and I think it has worked on the people. And now I believe you are also acting as one of the important heads out there in Laksamla.
Yes.
So if Sir could state how you got yourself associated to Laksamla.
Yes. So as I have mentioned, I was detected as HIV positive in 2006. But fortunately, I had an opportunity to go to Bangkok on a study visit held by Ministry of Health.
Yes.
So there we have visited many community-based organizations, many non-governmental organizations, and many ministries and many treatment care centers and all. So after I returned from Bangkok, then I realized that we should have a non-governmental organization in Bhutan.
Yes.
So in October 8, 2009, then we started with our first meeting among the HIV positive friends, which we meet during one of our consultation meetings conducted by Ministry of Health. So after that, 8 of us, we came together and then started discussions on the formation of non-governmental organization. So that's how we are an organization called Laksam, Group of HIV Positive today. So we got registered at the end of 2010. Then immediately after we got registered, we are lucky enough to have got our 3 proposal approved. And through that project, then we have to travel to 14 districts of the country. We networked, we built the capacity of our members. We provided care and support to our members. We advocated to the governments on the treatment-related issues. We advocated to the government on the human rights issues. Then we advocate to the general populations on the shared responsibility, shared concern to fight HIV and AIDS. Then we also encouraged people to come forward for the voluntary counseling and testing, which is very important as many people now are detected very late. So when someone is detected late, sometimes even the anti-HIV medicine doesn't work. So I feel that people should come forward and get tested. I'm alive today because I got tested on time. So that's how I think we should start thinking that we should make use of our life, make use of the services that have been provided by the government. It's work well done by the Minister of Health, integrated many HIV services now, even to the BHU levels. I think now it is in time that people should come forward and seek the services. Services are free. Like in many of the countries, services are not free. We should pay, In Bhutan, it is free. So I think people should make most use of it.
Now that you have come up with the formation of Laksamla, what are some of the roles and responsibilities of Laksamla? Like mainly, what do you focus on in the country?
So in short, in brief, Laksam's mandate is to empower people living with HIV and AIDS, to enable them to live in a very enabling environment, to make them strong, empower them, and then initiate their medications on time and live a better and normal life within their family, communities and all. That is our main mandates. But apart from that, our mandate is to prevent general population from HIV, because by our experience, we don't want other people to get infected like us. True. So that's why we are traveling to the districts and trying to advocate to the people that, hey, people, look at us. If you get infected with HIV, you're gonna, suffer like us. Be aware of it, Try to prevent yourself from HIV. Learn to prevent yourself from HIV. That's how we are trying to talk with the people. And we believe that whatever the communication, whatever the message that we give, whatever the advocacy that we give to the people, we feel that it is based on the behavioral change communication. It's because we are talking based on our experience, based on the living example, So we feel that it's a behavioral change communication. As you have rightly mentioned, now people are more aware of HIV. But the only thing is that they are not being able to put knowledge and practice together. That's all.
True. Besides all those awareness campaigns that you guys carry out from time to time, has it been able to create some benefits at a larger front?
Yes. Of course, in 2010, when we look at the people got tested for HIV, it's only 3,600.
Yes.
But after we came out in the media, when we look at the 2012 record, over 20,000 people got tested for HIV. It doesn't mean that it's only the work of Laksam. There are many factors playing around to make that happen. But we feel that people should get tested. More people should get tested in order to avail the services that we have.
Yes, thank you so much, sir. Basically, how do you keep yourself going and fit in your day-to-day life?
Yes, I don't do exercise much. But the only thing that keeps me healthy is that I live positively.
Yes.
I don't take much stress. I eat my meals on time. I sleep on time. Yes. I wake up on time. I go to my job on time. And I take everything positively. Whatever the misfortune that falls on me, I take it as my fortune. So that's why I feel that I'm still stronger.
Yet still, sir, despite keeping yourself on a positive move, have you been able to create that positive impact among the individuals whenever you are out socializing with them?
I feel that, yes, to my HIV positive friends also, whenever they see me as an example.
Yes.
Because of the thing that whenever I meet with them, I always try to ensure them you should always stand strong by heart, that nothing should move you, because the moment that you are moved by the influence, by the stigma, then you are finished. So that's why I try to live positively.
Plus, and then what about the thoughts of people, especially who aren't suffering the way other detected people are suffering? How has their attitude been able to change?
Yes. Before we came out in the media, whenever we conduct meeting or training or any activities, there were less number of people participating in our activities. Now, since we have come out in the media, we are experiencing, many people participating in our activities. And one story that I would like to reveal is that in one of the districts, before we came out in the media, one of our HIV positive friend, he was always drunk. Then he used to go to the counselor's house and he would knock very hard on the door, and then he would rashly say, "Why did you detected me as HIV positive? If you have not detected me as an HIV positive, I wouldn't have gone into such sufferings and all." But later on, when he saw us coming out in the media, actually he got empowered and he stopped everything and he was taking his medication on time, and now he's living happily with his family.
Yes.
That's, I feel that we have made a difference, and many other HIV positive friends over phone, they wanted to join our network. So I feel that we have made a difference.
Los, thank you for your time. Well, that was simply heart-touching and indeed an inspiring story from the Executive Director of Laksam, Mr. Wangda. Thanks very much for listening. Until next week with another program, this is goodbye.